So the dangers of high blood pressure are always evident, and high blood pressure is like any other chronic illness. If you don't take care of it, it's going to take over you and control your life. It's going to give you problems later on. Even if you don't think you're going to have any problems, it is definitely going to get to you. So it is always essential that you keep on taking your medication, follow with your primary physician. So I had a patient recently. He's a 40-year-old man who had been in the hospital about 2 years prior to presenting this time around. He came in with chest pain, headaches, dizziness, occasional nausea and vomiting. He comes in, he was found to have a systolic blood pressure of about 220, but a diastolic that's around 110. This is pretty high. We set upon controlling his blood pressure. It came down gradually and nicely with the resolution of his symptoms. But what ended up happening is that his heart had gotten weak. He started to develop fluid in his lungs as well as his feet. He said that this had been going on for the last few months. It was also gradually getting worse. He would feel short of breath when he would climb a flight of stairs, or any activity that required any type of exertion, he would have problems with that. As you see, he was developing heart problems because of his uncontrolled hypertension. When asked why he did not take his medication or did not follow up with his primary physician or any physician at all, he said he felt he was okay. He said he did not feel that he had any problems. He said it was a hassle to go to the pharmacy to take any medication. He said that he would always forget to take any medication. And because of this, slowly and gradually, he basically did not take any medication at all. And for about a year, he had not been taking any medication. So this is what happens. When your blood pressure is high, it puts excessive strain on your heart. Gradually, that leads to weakening of the heart. It may cause the heart muscle to enlarge, but that is not the enlargement that you get if you do exercises. With the heart tries to compensate for a while, but then slowly and gradually, that compensation is actually not beneficial. It actually leads to something called cardiomyopathy, which can be dangerous itself. Having said this, he was feeling much, much better, but the damage had been done. But he realized that from now on, he had to be very particular about how he takes care of his health. Not only that, we picked up that he is definitely also borderline diabetes. All these things combined put him at a high risk of having heart problems. He also used to smoke in the past. He has been trying to cut down on that, but whenever you do smoke, you do develop issues. Not only lung diseases, you develop heart diseases also. But in the end, I think he realized that he has to be positive about his health. He has to be punctual. He has to be compliant. He has to take his medications on time. And his health is not to be taken for granted. So there you have it, a reminder for anybody who does have high blood pressure. Take care of your health before it takes control of you. And again, it is your doctor's goal to prevent you from taking medication. But if you have to, you must take them properly. My friends, stay healthy and stay safe.
Thank you very much.
So I hope this was helpful. But if you want some more help, and you want to know about the whole meal plan for what a high blood pressure person should be enjoying, I have a whole meal plan divided over 1 month's time, divided into individual weeks, and with the recipes as well as the cooking instructions that you don't have to worry about when you go to the grocery store and you have all the ingredients for that particular week, week 1, week 2, week 3. And this can be a helpful guide for you to eat healthy. And hopefully this will supplement and complement your exercises that you are doing. So you can check this out in the description. It's free for you to use. Anyways, I'm Dr. Khan. This is what I talk about, naturally curing blood pressure. You like this? Then stick around, subscribe to the channel, and watch this video. I believe you will definitely like this for helping control your blood pressure as well. Thank you so much. Bye-bye.